just here to share experiences about healthcare services for persons with disabilities. Okay, I want to take us through the model that has shaped the way we think about persons with disability. And that is why I'm going to my first slide. We talked about the models of disability. This model view people with disability as a problem. They look at people with disability as a problem. They don't look at the person, they look at the disability. For example, people look at the wheelchair as the problem. Not patients as patients, not me as a person, but my wheelchair is the problem. So they tend to look at the wheelchair as patients. And what this means is that people with disability are looked at as being weak and being helpless. They are helpless people. They are weak people. And so all they need is a token. We should give them a token. Welfare. And then there's this other model that is on medical model, and it sees persons with disability as a defect or a sickness. It says they are sick. They have something wrong with them. They are deformed. And because they are deformed, they need to be cured through medical interventions. And so they refer to people with disability as a body not ideal. There's this big boss that have people that are complete, that have people that are normal, that have people that are so beautiful because they are complete. And so they tend to look at these other little boss like people that are not complete. And unfortunately, that is where people with disability fall into. Now, what is the effects of these negative models? People started building their mindsets, building their perception, building stereotypes against people with disabilities. So people with disability are subjected now to stereotypes on they are not normal, they are incomplete, they are not able. And so discrimination started to set in. And then a woman said in her story, growing up for me has been not too pleasant because wherever you go, people look at me as a different type of person. They tend to look at you and even your family as something must be wrong for them to have this kind of child. So I grew up with that mentality. Even my family labeled, stigmatized as a family that has an evil child. That is why family is being stigmatized and they are labeled. Because of this model, the charity model and the medical model that we just saw. Now let's look at it on the positive aspect now. The social model came into being after the United Nations came up with the UNCRPD. When so many people with disability and their organizations and development partners were in the United Nations to talk about this issue, and then they came up with a different model that tends to be positive. Instead of the problem being a person with disability, it is now seen as the environment. The ramp is a barrier. The sign language interpreter, if it's not there, is a barrier. So it's as a result of the social construct. Not the person, not the person. But another model came, and that is the right-based model. To say that persons with disability are part of diversity, just like age, just like a woman and a man, is a part of diversity. We are just living differently. There's nothing wrong with persons with disability. And so, persons with disability have the right to be included into the system. without no form of discrimination. Now, what is the effect of this positive model? It's actually the barrier, not the person. Disability is the barrier, not the person. Because if I am able to come in here, I will be able to do what I want to do. But if I'm not able to come in here, I will not be able to do what I want to do. So it's not me as a person, but my wheelchair and access. And then discrimination, not access. Reasonable accommodation, the interpreter. Negative attitude. The barriers are due to social constructs and not the person. What are the challenges now when it comes to healthcare services? Non-accessible healthcare facilities are not accessible. If you go to so many hospitals, even the community, I remember when I was part of those that did a survey with the Federal Ministry of Health to check how accessible healthcare services are to persons with disability. When I was doing this survey, I had challenges of barrier. I was not able to survey because there were so many barriers. I would sit in front of the entrance, and they would be pointing to me. You see that one there? I was not able to go in. So barrier versus barrier gave me non-discrimination against me for even taking part in the survey. Disability, so many people do not know anything about disability, especially when it comes to the health sector. There are so many personnel, staff, that have no idea about disabilities. They don't know how to handle women, especially with disability. They don't know how to communicate with persons with disability. And they are not trained on handling persons with disability. Limited information. Then healthcare services, it's high, especially for persons with disability. Medical staff don't have the right training, and then communication barrier as well. Listen to this woman with spinal cord injury. You see, most hospitals are not accessible for people like me. Who sees wheelchair for mobility? The treatment of spinal cord injury is very expensive to maintain. So if our treatments and medical equipment are subsidized or free, it will enhance our health. Sadly, most of our government hospitals do not have necessary equipment, which sometimes results to untimely deaths or cause more damage to the health or physical well-being of women with disability. I just want to share with you a kind of research that we did. It's a research that was done by a foreigner who used our organization as women with disability. The research was primarily on data collection based on interviews from 2013 to 2014, and 27 women with disability were actually interviewed, and these are some of the experiences they shared. The deaf woman said, during pregnancy, the nurse or the doctor, the chief doctor, come in and they lecture on how to take care of their pregnancy, how to use medicines, but there is no writing, only talking and no interpreter. You agree with me that the deaf is mostly left behind when it comes to communication. Another deaf woman said, during my pregnancy, I faced barrier regarding attitude of medical personnel, especially during antenatal and labor. They didn't make effort to provide communication. They just don't care. Many of the hospitals make life difficult for women with disabilities. Another woman said, actually, the first time I went to the hospital, it was like the nurses were surprised. What is this one coming to do in the hospital? Of course, they are surprised. This impression they gave me, like, you are on the wheelchair and you are pregnant. Sometimes they even ask the question, Who is this useless man that got you pregnant? As if I do not have any right to have a family. Women with disability feel. Persons with disability feel. Then they also shared about the financial barriers. A woman also said, I would say the challenges in terms of finances are very difficult whenever I'm going for antenatal clinic. I have to get a private taxi and to and fro. Then I have to do all the necessary blood tests. And still, you have to pay money. It is difficult for women with disabilities. Everything is encompassing, financially, medically, everything when it comes to disability. Another partnership building we had was a project survey that we did with Enhancing Nigeria HIV/AIDS Response. And we actually did it in support of Population Council. And we did it in 4 states. It will shock you to know that the key findings were 71% of the respondents indicated that they had sex. Because it was on sexual behavior of persons with disability towards HIV/AIDS. So 71% of the people agreed that they had sex. 40% had sex before they turned 15. 16% for women and 3% for men. Another finding was that women with disability face barriers to accessing needed sexual health information and services. And because of this, they are susceptible to sexually transmitted diseases, plus HIV, including HIV/AIDS. And then another thing is that the prevalence now showed that the women with disability were higher than the men. And we're asking ourselves, what happened? And then we now found out that the higher rate of HIV infection for persons with disability may be due to higher risk behavior. For example, people don't believe or people don't think that women with disability or persons with disability have sex. But the truth is that they do. And when they do, most of the time, they do it in secret so that people don't see because of the stigma. And then we also found out that it may be as a result of high sexual violence or low use of condom. Maybe the condoms are not available or they are not made available to persons with disability when they go to the facility, or they don't even want to go because of the stigma and how people will react when they go. Also, the study also indicated that there were very few sexual and reproductive health services targeted at persons with disability, particularly women with disability. Strategies for improvement. We need to train our medical staff and practitioners on the needs of people with disability, especially women with disability. And then we also need to think about introducing health insurance, community health insurance scheme, to also help those people to reduce the cost of health services. Then we need to promote partnership, NGOs, community-based organizations, CSOs. We need to promote them. And then we also need to ensure that health workers are aware of the specific needs of persons with disability, especially women with disabilities. We need to make our materials available in the format that they understand. Not in the general, but to the needs of persons with disability. For example, the blind, how are they carried along? The deaf, how are they carried along? We need to make sure that these materials are made available. Then we need to also make sure that there's equal opportunity in the health sector for persons with disability. Not in the general persons, but persons with disability according to their needs. And then we also need to raise awareness, let people know about persons with disability. Don't forget that we have the United Nations Convention on the Rights of Persons with Disability, Article 25, that talks about health, that says that states are required to recognize that persons with disability have a right to the enjoyment of highest attainable health care without discrimination. And the WHO said that health is state of well-being, physically, mentally, and otherwise. And when we talk about quality here, we are talking about health facilities, goods and services are being available and accessible in good quality to persons with disability, just like every other person, including safe and clean and potable water and personal hygiene as well. I just want to share about one or two experiences before I stop, and that is, let me go to the second one. Together Better, persons with disability can actually help you to achieve this goal. So it is always good to carry people with disability along. Like this person says, he says, I was the one who provided information to my gynecologist on spinal cord injury issues, such as how my urinary, circulatory, and other psychological system functioned. The gynecologists and obstetricians didn't even know about disability and pregnancy and were not used to dealing with it. But she was able to provide that this is how to deal with me. If you help me this way, I will be able, you can even, I will touch your life and you can also touch my life. So together, we can help each other. In conclusion, therefore, I just want to say that disability is everybody's business. It has nothing to do with only persons with disability or their organizations. It is each and every one of us. And then it is also key that we mainstream disability into every aspect, policies, programs, activities. We need to carry them along. And key, handling of persons with disability, we need to train our staffs. They need to understand what it means for persons with disability to be a part of the system. Nothing without us, nothing about us without us. So include persons with disability in the system. It is key to this whole idea, and of course it is key to the future of health of all persons, including persons with disability. Thank you so much.